Good day, sir. I am A.Reyes, your student nurse from Pamantasan, Lungsod, Marikina, and I will be demonstrating to you the abdominal assessment. But before that, I will explain first the rationale behind why we need to do this. So, the importance of abdominal assessment is to get more information that indicates the patient causing symptoms and to get more accurate diagnosis and to work and plan with the healthcare team. So after that, we need to always perform hand washing technique to prevent the spreading of microorganisms and to prevent the cross contamination between me and my patient. So next is we need to assemble all the equipment that we will be using. First is the stethoscope, the marking pen, and lastly is the measuring tape or the ruler. So sir, good day sir. I am A.Reyes, your student nurse, and what is your name? Okay. Sir, I will be assessing your abdomen, and then, sir, I just want to ask if are you okay in this room? What do you think in the ventilation of this room? Is it all right to you? Okay. Do you want to go to the restroom first so that there's no interruption or distraction during our assessment? So sir, I will be asking some question to you. Sir, do you have any problem in your abdomen? Have you ever undergo with the surgeries in the past? Have you ever experienced heartburn? So sir, to relieve those heartburn or pain, are you using or taking any medication? Okay. Sir, can you lie down for me? So, we need to position our patient into a supine position. Sir, I will be standing at the side of the bed and to see or to look for the contour and the symmetry of your abdomen. And so far, your abdomen is flat and that's normal. And then next is I will be looking if there is a presence of jaundice, body habitus, scars, and moles and masses. And then if there is a lesion, you need to measure it using a measuring tape or tape measure. And then, sir, I will be looking at your umbilicus, and then your umbilicus are flat, and I don't see any drainage or ulceration because some of the patient has a piercing on their abdomen, and you need to document it because it is important, especially the women's. They are have piercing in their abdomen. So after that, I will be looking for the respiration and then the pulsation of the aorta of our patient. And in the patient's abdomen, we can now proceed into auscultating the patient. So we will be using the stethoscope. To auscultate the patient, we will be using first the diaphragm of the stethoscope in all over the 4 quadrants. And I can hear the gurgling sound. so far I don't hear any abnormalities like root sound of the abdomen of the patient. And using auscultating or hearing the gurgling sound of the patient, we can find if the patient is hyperreactive or hyporeactive. So now, we will auscultating the vascular sound for the vascular sound, and we will be using the bell side of the stethoscope. From the umbilicus up to the aorta, and then at the side, which is the renal arteries. And then from the umbilicus down to the iliac, and at the side of this. So after auscultating the patient, we can now proceed into the palpation of the abdomen of the patient. So sir, do you experience or feeling any pain or tenderness in your abdomen? So if the patient says yes, skip the location where he is experiencing pain or tenderness and go back in that part after you finish in all over or you're done in the other part of the abdomen. So sir, I will be light palpate, or I will be doing light palpation, so I will press your abdomen lightly. Palpate the patient into a 4 quadrants, into rotary motion. So after light palpation, we can now proceed in deep palpation. So sir, I will be pressing your abdomen more firmly, about 5 to 8 centimeter, and tell me if you feel any pain or tenderness during palpation. So I don't find any masses and non-tender, and so far the abdomen of the patient are soft. And now we can proceed into the percussion in the patient liver border. Next is the splenic border. So after percussing the abdomen of the patient, you need to document all the findings of the patient. So that's all. Thank you for watching.